Hi there, this is Dr. William M. Chansa, and in this video, I'll continue with the laboratory values and investigations. So we are going to specifically focus on Google's tests in this particular video, and we'll do the rest of the other topics later. Okay, so under the Google's test that we have got the three important ones. Okay, so we've got the Google's tests, and then we've got what is called the glycosylated hemoglobin, also called HB1C. Then we've got the all glucose tolerance test, others call it OGTT. Okay, now under the glucose tests, we've got the normal glucose levels. It's between 4 to 6. That's a normal range. Okay, that's a normal range of glucose levels, which is supposed to be in millimole per liter. Okay, so now if you come to the hospital randomly, you just come right now and we do the random, or we test for you, we test for glucose on you. We call that random blood sugar. You just come, or we just find you on the road, then we tell you to say we want to determine your glucose levels. That is called the random blood sugar, and the normal should be less than 11.5 millimole per liter. Others use 200 milligrams per deciliter. If it's more than 11.1, and you've got, for example, a history of passing a lot of urine or passing urine frequently, okay, or you have got features of diabetes mellitus, then we can confirm diabetes just by that one single random blood sugar, which is more than 11.1 plus your symptoms and signs that you have. Okay, that's the first one under the glucose tests. The second one is called the fasting blood sugar. So you tell the patient to fast for at least 8 hours, 6 to 8 hours, and then you determine their blood glucose levels. So normally if someone is fasting, remember what happens. The body goes into what? In the catabolic state. Okay, by pushing in the glucose that was put in the blood. Okay, that was put in the cells to be pushed into what? Into the cells. That's what the body does. So if you have fasted for 6 hours to 8 hours and we do the blood sugar, we call it fasting blood sugar on you. So if you find that if it's more than 6.1 millimole per liter, then it's it's diagnostic for what? Diabetes, as long as you've got features of diabetes like polyuria, passing out of urine, polyphagia if you're an adult, and also excessive thirst, also called polydipsia. Okay, or if you just have the first two, you make a diagnosis of diabetes. First one and the second one, make a diagnosis of diabetes. Okay, and then the third one under the glucose test is what is called the 2 hours postprandial glucose. After taking a meal, then 2 hours they determine the blood sugar levels in you. So the normal is less than 7.7, because you know in that state the body is building up, is anabolic, so it pushes all the glucose in the cells, and you don't expect the glucose to be elevated that much. Okay, the second component of glucose tests, glucose test, is what is called glycosylated hemoglobin, also called HbA1c. So HbA1c, it helps us to monitor or to check how glucose has been controlled, especially for the past 3 months. Okay, that's what HbA1c does. Okay, so it's just a type of hemoglobin. If I ask you to say what are the types of hemoglobin that you know, of course you know the fetal one, you know the adult one, you know the sickle hemoglobin. There are a lot of hemoglobins that are there. You just have to memorize them. Carboxyhemoglobin. Okay, so glycosylated hemoglobin, it's a glucose that is bound to hemoglobin. It's there in the blood. Yes, are you surprised? I know you're surprised, but yes, if you have got glucose in your blood, there's some glucose that is bound to a hemoglobin, which is called glycosylated hemoglobin. So glucose bound to hemoglobin, we call it glycosylated hemoglobin. The normal is that in patients that are normal, they are okay. 5.5% of their blood or their red blood cells have got glucose bound to them. Okay, others you say 20 to 40 millimole per liter. Okay, but if the patient has got diabetes, their HbA1c is usually more than 6.5. Okay, it's usually more than 6.5. That's what you need to remember. So if it's more than 6.5 and the patient has got features of diabetes, you make a diagnosis of diabetes. Okay, but if they have got diabetes, you have diagnosed them of what? Having diabetes, or you know that they are a non-patient of diabetes for a very long time, and you want to monitor how their glucose has been controlled. Okay, you are going to use HbA1c. If it's less than 7, then meaning the patient is what? Is controlling their diabetes nicely. So it's got good diabetic control. And then if they are fair, it's 8 to 9. You've seen that HbA1c is elevated. Then if they are poorly controlling their diabetes, it's usually going to be more than 9%. And it tells you to say more than 9% of the hemoglobin in the blood is bound to glucose. And that tells you to say you've got lots of what? Glucose in the blood. That is the significance of understanding the glycosylated hemoglobin, also called HbA1c. Okay. The last one, but not the least, is oral glucose tolerance test, OGTT. Okay, this is the test where you have to fast maybe at least 5 to 6 hours or 6 to 8 hours. You fast some and then you come to the hospital. After fasting, they'll give you some glucose. Okay, we call it glucose or dextrose. Okay, a cup of glucose or dextrose, which will be mixed in what? Which will be added to water or normal saline. We usually use normal saline, 300 to 500, but usually it's 300 mils of what? Normal saline. You add that dextrose, okay, or glucose. So after doing that, then you give it to the patient. After giving it to the patient, then 2 hours after, are you getting what I'm saying? So 2 hours after, you determine their glucose levels. That is called oral glucose tolerance test. What we are doing is that we just want to know whether your body is tolerating glucose nicely. By tolerating, what do I mean? What I mean is simple and straightforward. You know, to say when you are taking a meal, you are consuming a meal, your insulin is supposed to be secreted from the beta cells of the pancreas. And what does that do to the blood cells? So the insulin is going to push all the blood glucose into the cells, okay, for storage, isn't it? And for metabolism, of course. Now, if you have got diabetes, your glucose is remaining in the blood. So we say, okay, this patient must fast. So after fasting, then you come to the hospital, okay, and then we give you a 2 grams, should be 2 grams if I'm not mistaken, should be 2 grams of dextrose. We mix it or we add it to at least 300 mils of normal saline, okay, and then we ask you to take it. So after taking it, and then we do what is called, we do we wait for 2 hours. So after 2 hours, we determine the glucose levels, okay. So now if you find that the glucose levels is less than 7.8 millimole per liter, okay, if the glucose level is less than 7.8 millimole per liter, then it means that you are normal, you are okay. Because we expect your glucose to be that high, to be more than 6, because you are in what? You're just from consuming, you're just taking a meal. But if your glucose is going to be between 7.8 to 11.0, I'll repeat that. If the glucose is going to be between 7.8 to 11.0, others will say 140 to 199 milligrams per deciliter, okay, then it means that you are not tolerating your glucose nicely. And that is called pre-diabetic or pre-diabetic. Yes. Your patient is pre-diabetic if I told their glucose is 7.8 to 11 after taking that 2 grams of glucose that I spoke about. The last one is that if you've done the OGTT and you find that 2 hours after giving the patient that dextrose that I've mentioned, and you find that their glucose level is more than 11.1, others will say more than 200 milligrams per deciliter, that is diagnostic of what is called diabetes mellitus, and it's a gold standard. Whether you are talking about pregnancy, normal individuals, OGTT is the gold standard test for diagnosing diabetes mellitus. Okay, and then I forgot to mention something very important here. Okay, I think I mentioned. The other thing is that if you have got a random blood sugar that is more than 7, okay, I mean the fasting blood sugar is more than 7, it's diabetes, okay, with symptoms. So more than 7, others will use 1.6 milligrams per deciliter. As the conversion factor between the millimole and the 200 milligrams is straightforward. So 1 millimole per liter is equal to 17 milligrams per deciliter. Others will say 1 millimole per liter is equal to 18 milligrams per deciliter. I think I would recommend you guys to be using 18 milligrams per deciliter. So 1 millimole per liter is equal to 18 milligrams per deciliter. So if you want to convert from milligrams to millimoles, you just divide 200 by 18. If you want to convert from millimoles to milligrams, you multiply by 18. That is all. So that means we are done with the glucose tests. Okay. Thank you very much to you guys. Twalumba, zikomo, twatasha. Litumezi, asante sana. Merci beaucoup. That was Dr. William M. Chansa, SMTCO, signing off. Thank you.